Good evening and welcome to the Chatham Board of Selectmen Monday, September 14th meeting. This meeting is being held as a COVID-19 Community Engagement Forum. Pursuant to Governor Baker's March 12, 2020 order and suspending certain provisions of the Open Meeting Law, General Law, Chapter 30A, Section 18, and the Governor's March 23, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of the Chatham Board of Selectmen is being conducted via remote participation. Every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. A reminder that persons who would like to listen to this meeting while in progress may do so by calling the phone number 1-508-945-4410. I'm going to ask that you mute your phones right now, please. Thank you. Conference ID number 408-03245#. Despite our best efforts, we may not be able to provide for real-time access, and we will post a record of this meeting on the town's website as soon as possible. And at this time, I would ask that if you are not speaking, to please disable your video and mute your audio. And you can do that on your phones as well by pushing *6. That's how you mute and unmute your phones to speak. The first order of business is I'm going to take a roll call of the Board of Selectmen to open up the forum. So Selectman Kokolas.
Here.
Selectman Metters.
Present.
Selectman Nicastro.
Present.
Selectman Dykens. He is not present at this time, but will be joining us later, and the chair is present. Okay, so I just want to set everything up for everybody, and first off, let the public know that aside from the Board of Selectmen on this meeting, will be the chair of the Board of Health is on the meeting as well. Chair Beckley is here. I believe all of the members are Vice Chair Ed Sheeran, committee members Dr. Noble Hanson, Dr. Alan Ward, Ronald Broman, and Burton Siegel. And on staff tonight, we have Dr. Robert Duncanson, Director of Health and Natural Resources, and our health agent, Judith Giorgio, as well as we have the Deputy Director of Barnstable County Health and Environment, Erica Woods, who will be answering some questions for us this evening. But first off, I just have a bit that I want to say, and then we can move on. Oh, I just want to ask if there's anybody that I've missed on the call from an official capacity. Don't know if there's anybody else from the county or from the state. Okay, hearing none. So we organized this meeting last week after the Board of Selectmen received information about the town becoming a red designation on the Commonwealth's average daily COVID incident rate map. And this is a designation that we will hold for 2 weeks. So we wanted to hold the forum and to get some information on how the Mass Department of Public Health calculates average daily incidence and the factors that led to reporting Chatham of having more than 8 cases per 100,000 population during the 2-week window. We want to make sense of the data. I think that's part of our goal tonight, and what that designation, how that designation came to be. But when we put the meeting together, we wanted to be able to to hear from the community and answer some of the questions that people may have and discuss some of the concerns. And then we'll have some discussion after. We'll have some discussion tomorrow to further we'll have a joint meeting tomorrow with Board of Health to further discuss this. But tonight we have set up an agenda that I hope will be efficient for everybody. My goal is that this meeting is 2 hours. We'll have the Board of Health and the Board of Selectmen make some comments, and then we'll have an explanation of the Chatham Red status. I think it will be Dr. Bob and our health agent that will be commenting on the data. And then we'll have questions by the Board of Selectmen and the Board of Health of the speakers tonight. And then we'll be able to field some appropriate questions to whomever whoever the question goes to. We'll have a bit of a discussion between the Board of Health and Board of Selectmen if we feel necessary. And we will be accepting during the comment period after the questions of the Board of Health, questions and comments from the public. We're going to start with emails tonight, and then we'll look for people to raise their hands if they have the technology on their computer to do so. I will keep a running tab of those who wish to ask questions and speak. And then we'll also ask for a verbal roll call as well. We'd ask that you keep your comments succinct and questions brief if possible. If you're able to, I think that will allow us to be able to have an open, good discussion tonight with everybody involved. So saying all that, our first order of business is to go over our agenda here that we've said. And I didn't know if the Board of Selectmen wanted to make any comments prior to our discussion with Dr. Bob making a presentation. Anybody have any comments to start or kick this off? Dean.
Yeah, thank you, Madam Chair. I'm obviously all ears, waiting to hear what various participants have to say, including the public, but also in particular, if we have a representative of the state, I don't know. I know we have someone from the county. I just want to make two quick comments. I think it's very important to understand, and I'm not saying anything that's startling, what the population is in the town of Chatham in the summertime. It's not 6,000, it's 20, 25, perhaps 30,000. And if that's the denominator that's used, we're not going to be in the red zone. Secondly, just a comment about color coding. I'm curious to hear the utility and usefulness of it from the standpoint of the state. The last color coding I remember imposed by the government from on high was back in after 9/11. The terror alerts, you used to see them on television. We've got an orange, yellow, or red. And I think it largely served to panic the American people. Eventually, the Department of Homeland Security decided to stop doing it. So I don't know. Maybe these do have some benefit, but I'm curious to hear the argument in support of it. Those are my comments. Thank you.
Thank you, Dean. Peter, you had your hand up.
Corey was ahead of me.
Oh, Corey. You're okay.
It's okay. All right. Nope. No, thank you, Peter. Thank you, Madam Chair. No, I know tonight is one piece of the larger discussion. I know this will carry over till tomorrow evening. I'm very much looking forward to a very open conversation with the Board of Health, our public, any other state or county officials that may want to weigh in if they're available now or in the short term. There's a lot of questions out there. There's a lot of strong feelings. We know a lot of stuff that we've been dealing with. We have a lot of stuff moving forward, which we may not know the full details. So I look forward to a very open public conversation on these items. Hopefully we can gather some questions that we can answer either tonight, tomorrow, or relatively shortly, and also identify certain questions that the Board of Selectmen, most probably the Board of Health, may want to address a little more detailed moving forward. So I appreciate having this forum tonight to kick off a much broader conversation, and I'll leave it as that.
Thank you, Corey. I must apologize to Vice Chair Ed Sheeran for omitting him as a member of the Board of Selectmen, Board of Health, present on the call. My apologies. So moving forward, Peter.
Yep, thank you, Madam Chair. I want to echo just a couple of comments that were made ahead of time. I am glad we could get this in and get it in before our next Board of Selectmen meeting. And there was a lot of discussion among us to move ahead. And in this kind of a forum, I think it's a great idea, and I thank the town manager for putting it out quickly so we could get to do something. I too am interested in what people are hearing. I've received it, like all of us have received calls concerned about the status and what does it really mean. I think there'll be some questions, just to be upfront on process. And if the state process is being followed, then is that enough or not enough, or are there concerns with what is being done, and if in fact we could do anything different? That's about it. And I sure do enjoy having more of these kind of community involvements on things that are an issue for the whole town. Thank you.
Thank you, Peter. I think the idea of having somebody from the state was foremost in all of our minds. Several of us reached out in different venues to different ways to get somebody from the state. I just, I'm a little disappointed we haven't heard from somebody today that they would be on the call, but we will address that going forward, and maybe we'll have some questions for discussion tomorrow. I'm going to be on a call with Senator Steer's office in the morning, and I will see if we can eradicate some of the issues with the phone call there. Yeah, I feel that this is the coding and the, I agree with you, Dean, the color coding is, and the way that the population was considered is problematic. And I think it has created some concern for community members that we talked about it. I was on a press avail and brought that to the attention of some of the people on the call, that we were considering this at 6,000 people, when in fact we do have a larger population in the summer. So that was kind of somewhat concerning. I want to turn it over to the Board of Health, to Chairman Beckley, to see if he has any comments before we proceed. Chairman Beckley?
I'm good to go.
Okay, thank you. Anybody from your committee that would like to make a statement? Hearing none. Okay, all right. Then I think what I'm going to do is I'm going to turn it over to Dr. Duncanson and or Health Agent Giorgio to speak to the data. Dr. Duncanson?
Thank you, Shireen and members of the board. So let me kind of just give you an idea of where we're at and what happened last week with the red designation under the state's criteria. So the state earlier this summer created this color coding of average daily incident rate with a couple of goals in mind. And I'm not from the state, so I can't speak in a lot of detail. But a couple of things they were trying to do is, one, they thought this would be helpful for communities that were planning to open their schools, as one way of giving folks an idea of, how widespread community transmission of COVID-19 was in the community. And that would then factor into decision-making regarding school reopening. The other thing that they were trying to do with this information was to allocate state resources. And by that, I mean that in a lot of the communities that were designated as red from kind of the get-go, the state would then bring in testing and other resources to help those communities understand why they were, having widespread community transition, and therefore what they could do about it. And the most significant of those was testing facilities. And so in a lot of the communities that are in the red zone, I'm getting a lot
hold on just a second. I think Mr. Chairman Beckley, can you mute your phone? Could you mute your phone? And anybody else that's come on, could you mute or disable your audio, please?
Okay, that sounds better.
Thank you.
All right, and as I was saying, the other reason was for the state to allocate their limited resources for testing and help with enforcement and all those kinds of things. So those are two of the big reasons why it led to this kind of color coding. It's something simple that the public could understand fairly quickly. It worked visually and whatnot. So for the first part of this, Chatham was either white initially, and then the state set up a gray category for communities that had less than 5 reported cases per 100,000. And the state developed a formula that they were using. They were using, you know, as we all know, we're in a census year. Our last census was 2010, but DPH partnered with UMass Amherst, and there was a group out there that had developed a way to kind of estimate population in the intervening years between those major census populations. And that was the formulary that DPH was using. So fast forward to last week, Chatham all of a sudden is in the red category, which means we had over 8 cases per 100,000 people. And the state's been doing this in 2-week chunks. So for every 2 weeks on a rolling average. For the 2-week period in question, which was August 23rd to September 5th, we had 7 identified confirmed cases in Chatham. So that was the number they were using. And, you know, when it first came out on Thursday, we reached out to the state to try to find out what the population number was they were using. We weren't able to get that number right away. So over the weekend, I went ahead and created a spreadsheet, and we're going to try and screen share right now so that everybody can see this. So hopefully everybody is now seeing a very simplified spreadsheet.
We can see it, Bob. Thank you.
Okay, good. So basically what I did here was I took our population from various sources, and I started with the 2010 census, which had us at a year-round population of 6,125. With 7 confirmed COVID cases. When you run through the formula, that would give you an 8.2 average daily incident rate per 100,000 people. I also used a number from 2018 from the Cape Cod Commission of slightly higher population, and you can see that that dropped you down to an 8.1 average daily incident rate. And then on the Census Bureau site, they also had a 2019 estimated census population of 5,982. That gets you to 8.4. So we're getting closer and closer to the 8.5 that the Department of Public Health reported in their report last Wednesday afternoon that led to the color coding of red being anything over 8, but in their actual formula or actually layout by town for all 351 cities and towns in the Commonwealth, they had Chatham at an 8.5. So I ran through a bunch of scenarios, and I was able to determine that if the DPH used a range or if the DPH used a number that was somewhere between 5,910 and 5,850, a number somewhere in there would give you the 8.5 that the state DPH was reporting. And I can tell you that about 2 minutes prior to the start of this meeting, I did finally get a call from Senator Sears' office. They had finally obtained the number from the state DPH. That number is going to be released later this week, along not only for Chatham, but a lot of other communities, because a lot of communities are raising questions with the numbers that the state is using. But I can tell you that the number that the state DPH is using is right within that range of 5,910 to 5,850. So it doesn't really matter what the specific number is, because anywhere in that range will get you an 8.5. So then I said, well, let's be realistic. We all know that Chatham's population is not 6,000 or 5,000 in the summertime. So I said, okay, what would happen if we use some of the very common summer populations? And the first one I picked just randomly was 12,250, which is 2 times the 2010 census. And so if you use 12,250 with our average, with our confirmed case of 7, you're all the way down at 4.1. So that would immediately get us back into the gray category, meaning less than 5 reported cases for 100,000 population. And then if you look at some of the other numbers that we commonly use for our summer population of Chatham, somewhere between 20, 25, and 30,000 people in Chatham during the summer. And those are numbers that we've previously used and previously reported to the state in various scenarios. You can see what it does to the average daily incident rate. It drops it down below 2.5. So that just highlights how important it is to use a realistic number as the denominator when the state is calculating these average daily incident rates, and how by using a number that does not reflect the seasonality of Chatham, or frankly any of the Cape towns, and frankly other areas in the Commonwealth that see their population increase in the summertime, DPH is not accurately portraying what's happening in the town. So that's the first thing that I wanted to do. The second thing I wanted to bring to your attention that I also ran, and let me get out of this screen share at the moment. One of the other things I also did was I looked at the next 2-week period. So if you recall, the 2-week period that got us into the red zone was August 23rd to September 5th. And we had 7 confirmed cases during that period of time. If we were to look at the next 2-week period, so starting on September, oops, and unfortunately I forgot to write them down in the right spot. So if we looked at the next 2-week period, which covered August 30th through September 12th, during that period of time, according to the state's COVID-19 tracking system, we only have 4 confirmed cases. Because as you can understand, as people either finish their quarantine or their isolation period, they come off that list, if you will. And so for that period of time, we only have 4 confirmed cases. When we do that, even using the 2010 census number, it drops us down to 4.7 for the average daily incident rate, which would put us back in the gray category. So either less cases or using a more accurate population number gets Chatham out of the red category. And then just one last thing that I wanted to talk about was the 7 cases that we had during that August 23rd to September 7th period. September 5th period. I know there's been some indication, or there's been some talk in the press, that those were all related to the Chatham Squire cluster. They were not. Only one of the cases related to the Chatham Squire was a Chatham resident. The other cases regarding the Squire were Harwich, South Yarmouth, and other communities. So the 7 cases that we had, it just happened to be coincidence that we had 7 cases during that 2-week period, and it coincided with the same time we had 7 reported cases at the Chatham Squire. Just quickly running through, one of the cases during that 7 is a student at a Central Massachusetts University whose home residence is Chatham, but he has not been in Chatham. He's been out at the university, but because his home residence is listed at Chatham, it shows up for us. We have at least 3 of those cases out of the 7 have cleared already, meaning they finished, they were positive cases, but they are now beyond the 10-day isolation period mandated by both the CDC and the State Board of Health. So they would no longer, as we go forward, would no longer be counted. One of the cases is still what I would call an active case. Based on information that was posted on the website today, the person is still experiencing symptoms, and so that would still be considered an active case. And then there was one additional case that, in spite of multiple attempts to get back in touch with the individual, the VNA has not been successful. So, but that one also would have cleared basically earlier this week, but we have no way to confirm that that person is no longer experiencing symptoms. So that just gives you an idea how fluid this situation is, how the information changes really on a daily basis, and how critical using an appropriate number for local population is to prevent these kind of situations from happening in other communities. And just, you know, in summary, we've only had 30 confirmed cases in Chatham since the beginning of this outbreak back at the end of February, early March. And I think that is a true testament to the community and how well people have followed the recommendations to, you know, not participate in large gatherings, wear their masks, self-isolate and all, and quarantine when appropriate, when you've been identified as either a positive or a close contact to people, as well as, you know, washing your hands or using hand sanitizer. I mean, recognizing the substantial increase that happens in our population every summer, and the fact that we haven't seen a huge outbreak in cases is a true testament, not only to our year-round residents, but also to our visitors who took the message seriously and have done what's appropriate based on, you know, appropriate public health guidelines. So with that, I'd be happy to answer any questions, or, you know, Judy's on the line. And we also have our representative from the Barnstable County Department of Health and Environment on the line as well, who can certainly chime in with any additional information.
Thank you, Dr. Bob. We're getting a little feedback. So would everybody please mute their phones and their computers? Thank you. Bob, so you're saying, just to clarify, that the 7 cases that we are attributing to this, to the data that's there, is not attributed to the Squire 7 cases, but are actually 7 Chatham residents.
That's correct.
Okay.
That's correct. Yeah, we're only using Chatham residents as part of these calculations, and 6 of the 7 Squire cases were not Chatham residents.
Okay, so that sort of just demystifies that portion of it a bit, and because that was a big, for me, that was a huge like question mark. Why are we getting attributed to something when it's always been about the people that are actually residents of the community? And in fact,
Yeah,
all right. So
it just happened to be nothing more than a coincidence that we had 7 cases at the Squire and we had 7 cases in town at the same time.
Great, thanks. I didn't see who got their hands up first, but I'm gonna go down the rank here. So I'm gonna go with Peter first, and then Dean for questions for Dr. Duncanson, or anyone else that might be able to answer them. You need to unmute, Peter, please. Thank you.
Okay, thank you. Thank you, Madam Chair. I understand, I like numbers, and I've always liked to use numbers, and I understand what has occurred. And it's obviously, I don't know, it's in all good intentions, somebody's trying to put up a way to show things like you mentioned, how bad or good something is, and without considering, you know, the every piece of data that goes into it, and especially something as important as the denominator we're talking about here. I was going to ask you about the process about the Squire, but I think you've answered it, because we've only had 1 there rather than having 3 or 4. Now, let me ask this question. The last time at the Board of Selectmen, our last Board of Selectmen meeting, the question was brought up. You know, there was 1 case of someone on a Sunday, then they closed, then they opened up again, then they had 3 more they were looking at. There might have been another case, and then they closed down again. You know, and I don't know the details of that, and that's the question I'm having. Is that really the case? If that was the case, is there an argument to be made that even though the Squire followed state procedures, is that still a good way to go, or am I looking at this all in the wrong direction? That's probably the first question. I might have a follow-up.
Yeah, that's a good question. I mean, the Squire followed the appropriate protocols. They reported to us on Sunday night that they had one positive case. They closed down Sunday evening, and they brought in ServPro. They did the appropriate, sanitizing and deep cleaning. They reopened on Monday for outdoors only. They then sent more employees for testing. Well, they didn't send more employees. They sent testing. They sent employees for testing on Monday, and it's through that they did identify 3 additional cases. And then on Tuesday, when that information came in, they then closed down until Thursday, and they brought ServPro back in to do another deep cleaning and sanitizing. They did indicate to us that none of the employees that tested positive were in the restaurant on Monday after it had been sanitized, Sunday night, early Monday morning. That those employees had all been identified as potentially in contact with the individual who was positive. So those employees were kept out. That's why one of the reasons why they only opened up the outdoors, because they were short-staffed. So I would say at this point that yes, the Squire did everything appropriately. In hindsight, you could always say, and I know one of the things we talked about with the Board of Health earlier, just preliminarily, was, when a restaurant has a positive case, they immediately shut down and send all their employees to be tested. And they don't reopen until all those test results come back. That's certainly within the realm for consideration. We now have more rapid test results, because one of the issues over the course of the summer was, it was taking quite a while to get test results back. And obviously, from a business standpoint, from an economic standpoint, that didn't work real well for the restaurants or even retail stores. Now that we have more accurate, rapid testing capabilities on the Cape, maybe that's not as much of an issue. But it's certainly something your board, the Board of Health, could talk about, tomorrow when you deep dive more into some of these potential ways of handling things differently.
Thank you. And my follow-up question had to do with the how well our testing can be done. I know that we have faster testing results. So you answered that question. Thank you.
Dean, you had a question for Dr. Duncanson.
Yes, I'm trying to unmute. Okay, thank you.
Mm-hmm.
Bob, I have really two questions and a comment. So just the other side of the coin regarding the number at the Squire. So my understanding is that there were 7 employees at the Squire who tested positive. 1 was a Chatham resident. Does that mean the other 6 cases are reported not as Chatham cases, but as cases from whatever towns or cities they're from?
Yes, that they would be reported back to their hometown health department. Yes.
So only one of the cases at the Squire was part of the Chatham 7, as it were.
Yep.
Okay. Secondly, I want to compliment you. I did once before, a couple of months ago, on your articulating a better explanation on CDC stuff than the federal government did. And in this case, I think you've done a better job explaining the state coding system than I've certainly been able to understand from reading what the state has had to say. Just with respect to what Peter was saying regarding the question he posed as to whether establishments should be required to do testing of all employees when a 1 or 2 cases or whatever the threshold is discovered. I think that's something I'm certainly hoping that we can talk about tomorrow night when the Board of Selectmen meets, after we assimilate all the information we take in tonight and hear what the Board of Health has to say. But I think it's going to be very important, and I understand Town Council is going to be participating tomorrow night, that we make sure we understand what legal authority we have to do something like that. And I took a look at the governor's restaurant protocols today, and even those protocols talk about a local board of health recommending, is the word they use. They don't use the word require. Recommending additional testing of an establishment. So I think we have to tread very carefully if that's the direction we might want to go. And there may be philosophical reasons, arguments about whether that's the appropriate course or not. So just wanted to lay the foundation for a discussion tomorrow night. Thank you. Thank you, Bob.
Thank you, Dean. I just want to note that Selectman Dykens has joined the meeting. Welcome, Jeff.
Good evening. Sorry I'm late.
No worries. Corey or Jeff, do you have any questions for Dr. Duncanson? I know, Jeff, you probably didn't see the presentation, but go ahead. Go ahead, Corey.
Thank you, Madam Chair. Not really any questions. I do want to kind of echo Selectman DeCastro, in this fact that, set a foundation for tomorrow night's, because how are the, a restaurants, they have so many elements. You got your wait staff, you got your front room staff, you got your cooks, you got your cleaning staff, any staff, any restaurant, anywhere. If this had played out differently and one of the employees had been working that Monday shift, how that would have played out. So I think we need to think a little bit broader, to figure out what is equitable, what is appropriate for both the businesses and the public. What steps are going to be required, and distinguish between a recommendation and a requirement. It's very, very different, very, very different. And especially in a little town like Chatham, because we have a lot of restaurant employees, well, some at least, that may work in other jobs. So how does that trickle about? So I think we're opening the door for a much broader conversation tomorrow night. I totally agree. A lot of questions, a lot more answers need to be thrown out there. Yes, I'll leave it as that.
Okay, thanks, Corey. Jeff, do you have anything that you'd like to say or comment for question for Dr. Bob?
No, my comments aren't going to be informed by the prior discussion. Unfortunately, this is our board meeting night. I was at the Duffy Finance Committee and Board of Directors meeting, so I was unable to participate in the conversation, but certainly I'm looking forward to either getting an update and or our conversation tomorrow night. Obviously concerned about testing and how deep and how widespread testing goes when we have a reported case. Understanding that we have to strike a balance between the health of our community, which in my mind is most paramount, and our ability to continue our lives and livelihoods. So we have to strike a balance, and unfortunately, we've been anointed or appointed a nasty red category, a hot zone category for one reason or another. And I would like to forego that particular experience again and do anything in our power to not have that happen going forward. So looking forward to the conversation, and I'm looking forward to hopefully artfully striking that balance between lives and livelihoods. Okay, and I'm sorry I was late, but I had no choice. Thank you.
No worries.
Look forward to tomorrow night.
Okay, great. I'm going to turn to Chairman Beckley of the Board of Health, ask if he has any questions for Dr. Duncanson.
I thought his responses were very thorough and illuminating, and I think it really does shape how we should interpret this recent classification.
Okay, thank you, John. Any members of the Board of Health like to ask Dr. Duncanson a question? You can just speak out if you'd like.
Yeah, this is Noble Hanson.
Go ahead. Go ahead, Noble.
I was wondering if Dr. Duncanson could comment on public disclosure. If a restaurant has a COVID case an employee that becomes positive, they notify the Board of Health. What are the state guidelines on disclosures to the public? I know that some people would like to know so they can make their own choices. So I would ask him that question.
Yeah, Noble. Right now, there's nothing in the state guidance that requires notification. Some businesses have done that. They've taken it on their own initiative, but there's nothing that requires them to do that other than they are supposed to notify the Board of Health. All the businesses, especially restaurants, do capture names and phone numbers for contract tracing purposes. But that's slightly different, than notifying everybody that was in an establishment. And you have to, I think, you have to keep in mind too, the idea of close contact. And one of the things that I was going to comment on in regard to what Corey and Peter had brought, or Corey and Dean had brought up, was, in the Squire case, using them as the example, not only did they have a couple of people test positive, or a couple of people test positive, they also had a larger group of people that basically went into quarantine because they were identified as close contacts. And that means somebody has to, go into quarantine for 14 days. So, from a business perspective, you could potentially lose a fair number of your staff if they are identified as close contacts right off the bat, without even having them tested. As long as they're identified as close contacts, and in a smaller restaurant environment, that could be a fair number of people. And that's one of the reasons I think why the Squire only opened the outside, after the first case was identified, because they had lost a fair number of staff. And then we get into the whole issue of what is a close contact. And both the CDC and the State Department of Public Health have identified close contacts as people who have been within 6 feet of a COVID positive case for 15 minutes or greater. So, that does not necessarily mean everybody that passes in through a restaurant or everybody that passes through a retail store is going to be a close contact. If you just happen to walk by somebody, or somebody who's COVID positive, let's say a server walks by your table, that does not make you a close contact. And even the CDC recently on Thursday, came out with a report that indicated that there's about a twice chance of getting COVID-19 if you'd been in a restaurant, based on some data that they collected back in July in Massachusetts, as well as a number of other states across the nation. But again, they reiterated the point that you really need to be a close contact to increase that chance. That in general, even being in a restaurant, and unfortunately the study did not make a distinction between takeout being served in an outdoor space at a restaurant or being served at an indoor space. They just kind of lumped attendance at a restaurant or going to a restaurant as a whole, in that increased risk. But it really was, they reiterated the point that you really need to be in a close contact with someone, and merely, your server coming by, taking your order, and then bringing your food, and then the check at the end, chances are you are not going to be considered a close contact. And so we have to factor that in as well in terms of considering, kind of blanket criteria for restaurant workers or others. So.
Thank you, Bob. Any other questions from the Board of Health members? And you are welcome to just speak out, because you're all on the phone.
Bob, this is John Beckley. I have a question. In a scenario where you had, say, the Squire, and they arranged to have all the co-workers tested, what would become of the close contacts? Would if they were tested negative, they would still have to continue the 14-day quarantine, true?
That is correct. Even if you test negative during that period, you still have to quarantine for the whole 14 days, because that's generally considered the incubation period for COVID-19. So, you could get a negative test on the second day and then, exhibit symptoms 3, 4, 5, 6 days later. Okay. So yes, if you're considered a close contact, you are quarantining for the full 14 days.
Thank you.
Irregardless of any test result.
Thank you.
Okay, we're going to move on to ask if the deputy director of the county has anything she'd like to say in regard to the data. And then we're going to ask for some questions from the public. Erica, are you still there?
Yes, I am. Thank
you.
you very much. I'm gonna not turn my camera on because, oh, maybe I am. Hey, there you go.
Hi.
So I don't know that I have a whole lot to add to that. I think Dr. Duncanson covered everything. I think the definition of a close contact is something very important as well, as he pointed out. It is contact, for 15 minutes or longer within 6 feet of a person. That is whether or not the individuals have a mask or face covering on in general. And it's another thing to consider as well when you're looking at how to respond to some of these situations, in that just because an individual works at the same restaurant as somebody that tested positive doesn't necessarily mean that they came in close contact with this person. So it's really, looking at the whole big picture, I think, rather than, focusing on specific things, which unfortunately is tough because we all want those answers. And I think, that's what the color coding system was an attempt at, but unfortunately it brings us to situations like this.
Okay, thank you very much. We're going to move into the public portion of the questions and field some of the questions to the individuals on the call. I guess the first and foremost, Shauna, do you have any emails that you'd like to share right now? Maybe a couple
Sure.
at this time. Okay.
There were several that were related to how the case count was calculated, and I think Dr. Bob answered that. Also, a few questions on how which community the positive cases are attributed to. So I think we've pretty much covered that. There's been some suggestions submitted for handling an uptick in COVID cases. Number one is to limit restaurants to outdoor dining only, particularly because mostly restaurant workers seem to be testing positive. More enforcing of rules. Someone cited the Cape Cod 5 and about half of people not wearing masks in the mandatory mask zone at the drive-up, and suggesting surprise inspections of all restaurants and bars, including private clubs. There's also some questions pertaining to the visitor quarantine and if there's any mechanism in place to enforce that in short-term rentals and hotels. Also, again, reports of establishments requiring masks on their workers when they're in contact with the public, but not necessarily when they are in situations where it's just staff and employees. That should be enforced by management to make sure that masks are worn at all times.
Okay.
That's a few to start off.
Okay, great. Is there any comment from on the idea of surprise inspections and things like that? I think that these are things we probably can bring up tomorrow to talk about it in more detail. But it's my understanding, Judith, maybe you can answer this, that everything is self-regulatory at this point, or self-certified. Is that how things work? And then if somebody files a complaint, then an inspection happens. Is that how the protocol goes?
When people file, yes, certainly when people file complaints, we do follow up. But we have also done a fair number of surprise inspections, not just as follow-ups, but just as our routine restaurant inspections. We had a summer sanitarian who used a shortened food inspection form this summer, and she went out not randomly, we gave her a list, and she went into places unannounced, and so we did quite a bit of that this summer. But for the most part, we follow up on the complaints as they come in, and that seems to be very helpful to the business owners when we talk to them about the situation.
So what is the protocol? Is it education first and foremost? And did everybody somewhat be in compliance? Did you have any
Yeah, I mean, there is a self-certification form that they're supposed to have posted, so we would, reinforce that, give them the information that they should have and should be going over with their employees. We did not cite anybody. It was mostly just educational. We had follow-up discussions with some people. And then there were a few cases where we referred a few things up to the state level. When it was more of a workplace labor standards type issue.
Okay, thank you very much. So I guess for right now, we're going to ask if there are people who want to raise their hands to ask questions. This will be our remote participants. Before we get started with that, I see that Corey has his hand up, so I'll let him ask a question, and then go ahead.
Thank you, Madam Chair. I was actually just this just kind of popped in my mind when Judy was talking, but I do want to throw it out there, because this is something our local Board of Health, I own a small business in downtown Chatham. It's a food business, and our Board of Health, brought this out to the attention of all food handlers who have to deal with inspections and permits at least a year, maybe it was 2 years ago. I got to jog my memory, but most of us, and Judy can confirm, I guess maybe percentage wise, but there's a tool that we have these forms that we have our employees sign that says if they are feeling nauseous or any type of fevers or the whole spectrum of scenarios that they report it to the business manager or owner, and they don't come to work, and there's a whole listing of protocols to kind of protect the businesses themselves, co-workers and stuff. So this is something our local Board of Health has brought out to the people who have licenses in town. It's a great tool. I had someone from Barnstable come by specifically looking for COVID-19 scenarios in my business, and that was the one item that they were specifically looking for. So. I think our Board of Health has done a great job preparing the Chatham businesses to know what to do, what to look for, and what to add to our process. I just want to put it out there. I think our Board of Health has done a great job preparing the downtown businesses or town businesses in general to deal with this and prepare ourselves for such a large task. And I appreciate the help that the work they put into this. So. I just want to put that out there. Thank you.
Okay. Thanks, Corey. I do want to get to the public, and it is 7 o'clock. I see that Dean's hand is up and Peter's. So Peter's hands just went down. So Dean, if you want to ask a question, then let's get to the public afterwards.
Just one quick question to Judy. Judy, have we had many complaints regarding food establishments since they were allowed to reopen under the governor's plan?
We've had a few. We've probably had more complaints about other types of businesses. Too many people inside, not wearing masks, employees not wearing masks. But for the most part, the restaurants, I don't get a lot of complaints. A couple of times we've had to remind people to spread their outside tables out apart. But no, I really haven't had a lot of complaints about, not wearing masks or poor food handling or anything like that. They've been very good, and I do my best to keep in touch via email to all the restaurants with reminders, and whenever anything changes, we try to get that information out. And so we have a good line of communication, and I think the restaurants have done a very good job.
Thank you, and I just want to echo what Corey said in complimenting the Board of Health and the Health Department. Thank you.
Thank you, Dean. If you have the capability to raise your hand with your in your team's meeting, please do so now if you have a question. And
Madam Chairman.
And then I will ask for a roll call of everybody. So I see that we have one person raise their hand, and then I just heard somebody speak up. Can you say what your name was, please?
Yes, it's Gloria Freeman, and I was just wondering how, if you're on the telephone, you raise your hand.
Well, as I explained, I was going to take a roll call of everybody who does not have that capability as well. So
thank you.
I'm just making a list. Did you want to speak, Gloria?
Yes, please.
Okay. Anybody else? I'm taking a roll call. Anybody else that would like to speak?
Elaine
Lawrence,
Gibbs.
I'm sorry, one at a time.
Elaine Gibbs.
Okay, Elaine, anybody else?
Lawrence Skelton.
Florence? I got Stephen, your hand was up, Stephen, I
No, I
said.
can't do my hand up, but I unmuted.
Thank you. Anybody else would like to ask a question or make a comment? Okay, so we'll go through this and then maybe there'll be more after we get started. So I'm going to start with Stephen Buckley. Hi, Stephen.
Hello. I just wanted to say that it's been very enlightening to hear from Dr. Duncanson about the information about things like the fact that people who have COVID who are not currently residing in Chatham, like college students from far away, are being counted against our or for our red zone. And also the fact that they're assuming that there's only 6,000 people in Chatham, which is not the case in the summertime. So I think those are the types of things that if we had a public relations person, and I think there was, the town manager was asking for somebody along those lines for a position, but the idea being that not a spin doctor, but somebody who could explain these things to us or to the public, to the greater public, those very relevant aspects. Oh, okay, well, that doesn't count. Oh, okay. And put it in terms that we don't get too much into the data, but just explains those key aspects to show that we're not as red as you think we are, and explain those things. So that's what I would suggest. And I would say that there's probably about dozens of former public relations people who are retired to Chatham who would love to help the town craft that message. So that's what I would suggest. And of course, you probably remember, it could be even an advisory committee on communication. So just another example of how we need to do a better job of making things more clear to the public and to everyone at large. Thank you.
Thank you, Stephen. I do want to add that we do have a weekly communications report going out to the public. We have regular updates at the Board of Selectmen's meetings on Tuesdays, and we are having this forum tonight. So we're getting information out to the public in many different aspects of the way we're dealing with this. But thank you for your suggestions. Next person that wanted to speak was Gloria Freeman. Gloria?
Thank you for this opportunity. I have a question and a concern. My question is, can Chatham provide more stringent regulations to protect the public health than the state's regs? We've talked around that, but at least I have not heard the answer to that. So if someone could answer that for me, because I believe we need to implement some changes which provide greater protections.
Do you want to make your statement of concern before we ask Dr. Duncanson or the Board of Health Chair to comment on that?
Oh, sure. And that is that I believe that public health concerns and protections should be our primary concern. Impacts to the local economy are very important, of course, but certainly not to be balanced with public health, as has recently been stated. There should be no trade-off. We need coordinated economic and public health responses, but our objective should be to mitigate the spread of disease and to reduce mortality, especially with our age demographic.
Thank you, Gloria. Dr. Duncanson, well, I guess John, as the Board of Health Chair, in your authority, and it's my understanding too that we could go beyond what the state has mandated or suggested. And we've had some examples of that earlier. Do you want to speak a little to that, John?
Well, certainly in the wording of the statutes, there is broad authority given to municipal boards of health to take all kinds of steps. So the short answer is yes, it's permissible by law. I think the harder question is, under what circumstances should a local authority consider that? How compelling it must be, and what are the trade-offs? And that's really a careful judgment, a weighing process that you've got to be careful with.
Thank you, John. And we'll be speaking to some of this tomorrow, obviously, as a follow-up to this meeting. So thank you, Gloria. The next person to speak is Elaine Gibbs.
Yes, I just wanted to reference something that was said earlier, that the numbers are influenced by, we're counting 30 people, but some of those people are at school. And so, that hurts our numbers. Well, the opposite is true too. If we're starting to talk about the number of tourists that are in here, how many tourists have gotten COVID in Chatham, but we don't know about it. They may have infected people long term, but they're being reported in their home state. So I think that balances out. My other concern is that we are pretty much 6 months into this now, and we're not really sure what the power of the Board of Health has. To say that it has to be pretty compelling for us to do something beyond the state. If a pandemic, COVID, isn't compelling, I don't know what is. Boards of health have shut down restaurants for far less. Salmonella or some kind of problem, and they make everybody get tested. I think that a good example is the watershed in Brewster. The Board of Selectmen shut them down for a month because they were not socially distancing. I think there are two issues here. One tonight is primarily mitigating the public relations damage done by the fact that we got on the list. But then the second is that we have a second cluster, and they're all amongst restaurant workers. And I have a concern about this specific one. On the Sunday it occurred, there was a positive test. They cleaned overnight. On Monday, they opened up for lunch and dinner, but 15 tests were pending, and the public didn't know that. 3 came back positive. They closed again, but then they opened up on Thursday and Friday, and again, the public didn't know it, and then they came back with 3 positive tests. Now, I think there has to be transparency, and one of two things has to happen. You have to put a sign on the door that says, we are in the middle of a COVID cluster, or I think the more politically smart thing to do is to shut the restaurant down and make sure all the employees are tested. We have these rapid tests now. They don't take very long. The Squire can't have more than 25 or 30 employees. And to say that probably 1,000 people went through the restaurant from the time, during the incubation period and then that following week. And no one was called because nobody was supposedly in contact for 15 minutes. First of all, you're asking ill people to remember who they came in contact with for 15 minutes. But we also know that COVID is spread on contact, on surfaces. And so it may not be the wait staff who's serving the person, but the plates are in the kitchen. There's silverware, there's glassware, and the food plates served. So it can be spread that way. And I have to tell you, if I have been religious about socially distancing, as have my children. And if I had gone there with my family and then found out later that there was a COVID cluster, I'm telling you, I would be very, very upset. And I think that now that we understand that this is an issue and the town has been notified of this and we understand that, I think it's negligent not to take a further step. Because I think we're opening ourselves up to some liability if some people get sick and say, you never told me there was a cluster. So I would hope that we do that and get everybody tested and move on. It doesn't really matter whether or not Baker's test, his algorithm is wrong. He's the one calling the shots. He's the one that can kick us back to phase 2. He's the one that can close our schools. So we need to show that we are being proactive, and we've got to prevent that from happening, because ultimately, if we have a third cluster, it's going to hurt the economy. We got to put that, the economy will take care of itself if we can nip this in the bud. Thank you.
Okay, thank you. I think we had Florence next.
Yes, thank you. I have a question. In terms of the 2-week quarantining, how do we monitor that? We have had in my neighborhood a number of properties that are rental. And I have seen that some of these rentals are a week. People go in and out. They have cars coming to visit. Who monitors that, that you have to have 2 weeks of quarantine? And then I have another comment also, but who monitors that? How do we know that people are doing that?
Okay. So Judith, is this a question you can answer? Because I thought that the travel advisory Florence, are you talking about quarantining people that are traveling to Chatham?
Yeah, people who are coming here and renting. They're renting properties on our street, and they're not. Some of them are not staying for 2 weeks. It's the same. A car is there for a week. They go in and out all the time. They're going to the beach. They have people come to visit them because other cars are coming in. We're asking people to quarantine for 2 weeks. How do we know that they're quarantining for 2 weeks? And they're coming from out of state. Some of these people are not the license plates. I understand you don't have to if you're Massachusetts, but there have been many other states.
So the governor did lift the travel ban to certain states.
Correct.
And there were some that weren't, that still apply. So I guess my question is, I mean, I think I know the answer to that, but I'm going to ask Judith or Dr. Duncanson if they can explain the travel advisory order.
Well, I've read it, but how do you implement it?
Yeah,
Dr. Duncanson.
Yeah, the travel advisory is, you're expected to self-monitor. The state does take your contact information. They tell us that they are reaching out every day through text messages, reminding people, but we and the state are not posting armed guards at all these locations and making sure that you stay inside the house. So, that's the way it's being done. There is no active enforcement, if you will, by either the state or by the local town. And the state was very clear on that, when the travel ban came out or the travel advisory came out, that they were not expecting, aggressive enforcement.
And then I'm sorry.
That's all right. Go ahead.
I have a comment. As you and the health department are moving forward, and as we're getting to colder weather, I think we need to think about what is going to happen as the outdoor sections of the restaurants are closed, are not able to stay open because of the weather, and are moving indoors. There was an article just this week in the New England Journal of Medicine that spoke to that issue of the restaurants and the dangers of being indoors. I don't know what you can do about this. I know they're only supposed to have a certain percentage of people inside, but not everybody, not every restaurant has adequate and good ventilation, HVAC systems. Look at the schools. There are some schools who are not being able to open because they do not pass the HVAC tests. We're not having that. So I guess consideration needs to be given to the fact that although the New England Journal article was based on a small study, it still is something to think about in terms of the possibilities that exist when people move indoors only to restaurants. And final comment, I do appreciate the weekly updates that we get from Dr. Duncanson and from Town Manager Goldsmith. I think they're very helpful and give us a great deal of information. So thank you.
Thank you, Florence. Shauna, are there any other emails you'd like to read right now?
Sure. There were actually a couple of other emails regarding short-term rentals and how the town can have better oversight and management of them. Concerns about, again, overcrowding in some of those rental properties. Additionally, there's some questions about another round of testing, free accessible testing, if it could be made available, and a couple of questions about rumors of how many cases are unreported, and as I would assume, testing is the only way to detect COVID in people who are symptomless. So I don't know if we could get any additional information on possible testing due to our designation.
Well, we have Deputy Director Erica on the call. Maybe she can tell us what the county is providing for, or what their outreach has been for additional testing on Cape Cod. Erica?
Yes, I am. Yes. So a couple of things. First of all, we do have the ability to, basically we have the connections to pull together pop-up testing sites, which we have on a couple of occasions over the summer when we did have some of these outbreaks in the restaurants. We're also working with some agencies to make sure that we can provide testing that doesn't necessarily require symptoms, because I know this is one of the things that we run into, is that if there's no direct contact, there's no symptoms, there is limitations on what they will allow for testing. So we're working on that. You know, it's one of those things where, you know, we can generally adjust to specific situations. We're also looking into funding from the state to provide this testing. But one of the things that the state is doing is also increasing the availability of mobile testing. You know, we happen to be talking about restaurants, but obviously the other concern is schools. So they are mobilizing some mobile units, which the requirements for these mobile units is that they can relocate on 48 hours notice if there's a large outbreak. Obviously, the point is to avoid those outbreaks and to follow the protocols with proper masking, social distancing, et cetera. But again, you know, testing obviously is important. The other thing that I just want to point out as well is that there are different accuracies on different tests. The molecular test still remains the gold standard, and that's the one that we rely on to give us accurate results. Fortunately, we've been able to identify different laboratories that are able to reduce the turnaround time. I know it got up to, you know, 5 to 7 days there for a while. From what I understand, it's definitely gotten down from there. But we just want to be careful. The antigen tests, you know, again, it depends on the specific maker of it, but those can have a high false negative rate on those. So the quick tests aren't always the way to go on these. I hope I answered the question, because I think it dropped out a little bit there. So
No, you were fine. Thank you very much. As far as the short-term rental issue, I know that Selectman Kokolas has asked for an agenda item request that we start to look at some of the issues around short-term rentals, how many we have in town and where. So that's coming forward. It might not come as quickly as we'd like, but hopefully we'll have it. We'll start that process. I just want to remind everybody that we will be accepting emails, questions and comments up until Tuesday at 4 o'clock. And the email is communityforum@chatham-ma.gov. Shauna, do you have any other emails that you want to speak to?
Yes, one other, and it's sort of the outlier, but it needs to be brought forth. In addition to several emails asking for greater enforcement or what other restrictions can be put in place, we did receive one that takes the other side and really asks for sensible guidelines and stopping the hysteria, having scared everybody to death. In other words, how do you unscare them? I can only imagine what will happen when the inevitable flu season hits, as it does every year. Where will all this government overreach stop? So that's a different concern.
Thank you very much. Okay, I'm going to ask again for a roll call of anybody that would like to speak, has a question or a comment right now, and you may say that out loud and I'll take your name and then call on you. Is there anybody else that would like to speak tonight? Okay, I'm hearing none. I think that it's 7:15 and we've had some good information that has come forward. I want to bring it back to the board and the Board of Health for comments, knowing that we are going to hold a joint meeting tomorrow to recap this forum tonight. We're going to have that joint meeting with the Board of Health and see if there's any actions that we want to take forward. But if there's anything that my board would like to speak to right now, I welcome your comments or questions or your recap here. Peter, I see your hands up.
Yeah, thank you, Madam Chair. No, my only comment is I appreciate the public input we had. We had some good comments and some good oversight into what we can discuss tomorrow. I think as we all know, we're going to have to look at whatever we can do beyond what the state says with a certain amount of scrutiny and be concerned with whether or not it makes sense. And I understand the concerns that we should move ahead, but we have to hear, I guess, all sides of that. And again, I think there was a lot of good input. And I would remind everyone that when they're on the line, please, mute your phones and your video. Thank you.
Thank you, Peter. Corey, your hand is up.
Yes, thank you, Madam Chair. No, I know we're going to continue this conversation tomorrow evening at our regular Board of Selectmen meeting. I would just hope that we continue the including of our public input. I think it is very vital to have this dialogue, different perspectives, different questions, different thoughts, different questions, that are from a business perspective, from a philosophical perspective. So I just hope we can maintain this public dialogue because it is vital to the process. So I look forward to continuing this tomorrow evening. Okay,
thank you, Corey. That was very thoughtful comments. Anybody else from the board, my board, that wants to speak to this? Okay, I'm going to turn it to the Board of Health, Chairman Beckley, to see if he'd like to has some final thoughts.
I'm fine with what I've heard, and I think we've learned some different perspectives and some interesting things to think further about. I will invite anybody from the Board of Health that wishes to offer their comments to speak right now if they'd like to.
Any comments from the Board of Health members? Okay. Well,
yeah.
I'm sorry. Did I hear somebody?
Sounds like we're good.
Okay. Thank you. Thank you, John. So our next steps are that we will continue this this forum tomorrow. But I do want to appreciate the work that the Department of Health and Natural Resources has done in the last several months. I think that Dr. Bob and Health Agent Giorgio have put in so much time and energy into the wellness of our community, and has been very helpful in explaining along the way a lot of complicated issues that we've had. Obviously, nobody's done this before, but I appreciate their work and also the work of the Board of Health. I think that they're a stellar committee, and they've done a great job in keeping the community safe. And I do appreciate the community keeping itself safe. I mean, 30 instances since January is not great, but it's low numbers, and it is due to the hard work that everybody did in communicating and caring for their fellow community members. Of those 30 people that have had COVID, I wish them all well. I hope that they have they're faring well during this whole process. That's one of the things that we're not hearing a lot about when we talk about all these numbers and data and everything is how are your community members doing? Are they okay? And are they well? And I think we need to always keep that in mind too. So I want to thank the people that spoke tonight. I especially want to thank our deputy director from the county in Woods, and thank her for taking some time tonight. She's a very busy person as well. The county's doing a lot. They're doing yeoman's work out there as well. So saying that, any final thoughts from my board at all? We'll accept a motion to adjourn.
So moved.
Second?
Second.
Okay. I'll take that roll call then. Selectman Kokolas,
Aye.
Selectman Matters,
Aye.
Selectman Dykens,
Aye.
Selectman Nicastro,
Aye.
and the chair says aye. Okay, thank you. This meeting is adjourned. Thank you, Chatham. Be well, stay safe, wear your mask, wash your hands, and we'll continue this discussion tomorrow. Thank you.
Cheers.